This is Alice Shapiro, your instructor for HIT 154, and this is the screencast for sexually transmitted diseases and diseases of the reproductive system. And again, here are the objectives I have for you. If you don't remember your basic terminology for reproductive system, please review and basic anatomy. I want you to be able to describe the key characteristics of the diseases of the reproductive system and of sexually transmitted diseases. And I have chosen just a few to be illustrative of these conditions. I want you to understand the etiology, signs and symptoms, diagnostic tests, and possible treatments for those diseases that I have selected. Okay, let's move on to the next slide. All right, the diagnostic procedures are to do a sexual history, physical exam, pelvic exam, pap smear, laparoscopy, mammography, ultrasound, rectal exam, or cystoscopy, again, depending upon the disease in question. We'll start with some diseases of the female reproductive system. I'm not going to talk about all of the diseases, but rather use some for examples. And just to list, there could be infections, tumors, or cysts developing in the reproductive organs and or in the breasts. Also consider the abnormalities of the menstrual cycle and of pregnancy that might occur. And we're not going to be talking about all of these in this class. Neoplasms, or literally meaning new growths, which often indicate cancer. An important aspect to prevent the spread of these diseases, particularly malignancies, is early detection and diagnosis and treatment. Many tumors and cysts are harmless, but a test should be done to rule out malignancy or to confirm it. Here is a diagram of first of all, the breast profile to indicate the views of what could be ductal carcinoma. So here's the breast profile, which is illustrated up here, letters A through G, showing you the normal anatomy of the interior of the female breast. And then an enlargement shows letter A, the normal duct cells, letter B, the ductile cancer cells, basement membrane, and the lumen, or the opening of the duct. All right, so an adenocarcinoma, adeno, as you may recall, hopefully from medical terminology, refers to glands. So adenocarcinoma is any cancer of any gland, but in this case we are looking at cancer of the breast ducts. This is the most common breast malignancy and the leading cause of cancer death in women. The leading cause of cancer death in women. Here are some of the signs. A hard fixed lump, generally in the upper quadrant of the breast. Benign tumors are encapsulated and not fixed to underlying structures, so they have a different kind of feel than malignant tumors, but often a biopsy is definitely needed to confirm. The nipple could retract and the skin could dimple, but this doesn't always happen. The axillary lymph nodes may become swollen. The causes of adenocarcinoma are not clearly known. We have talked about some of the risk factors. Could be family history, exposure to radiation or other carcinogens. So please recall some of the factors that we looked at during the link between environment and disease. Age has an influence. A person who is never pregnant is at higher risk. A woman having her first child after the age of 35 is a higher risk. Early onset of menstruation and later menopause. And these have to do with how often, or I should say how long, a woman is exposed to estrogen, because estrogen does promote some types of breast cancer. There are various treatments. It could be a simple or a radical mastectomy. Radical mastectomies are not utilized as often as they were in past decades. Lumpectomy, chemotherapy, radiation therapy may also be utilized. Here is a diagram showing you ductal carcinoma in situ and then also as an invasive cancer. Endometriosis is a condition, a disease condition in which the endometrial tissue from the uterus becomes embedded elsewhere. Some of the causes or ways this could have happened, the tissue may have been pushed backward through the fallopian tubes during menstruation or carried by blood or lymph to outlying areas. It then takes hold on another structure in the peritoneal cavity, could be the ovary. The endometrial tissue, by its nature, responds to hormonal changes even when it is outside of the uterus. And if you remember general information about the endocrine system, the response to hormones has to do with various receptors on the target tissue. So the endometrial tissue is still endometrial tissue and will have the same receptors that will respond to the hormone, whether they are in the endometrium, the normal inside the uterus, or some other location. And of course it causes pelvic pain, abnormal bleeding, and dysmenorrhea, and it could cause sterility and dyspareunia, which is pain during intercourse or after. All right, the etiology is not known, and it can only be diagnosed by actually seeing the tissue, so a tissue biopsy of other tissue may be taken. Treatment varies according to the extent and the age of the patient. Hormonal therapy is used in young patients during pregnancy with the absence of menstruation, and some of the hormones that go along with this may keep the condition in check. And if there is extensive proliferation, this may require surgery. Extremely painful condition. Here's a diagram showing you the common sites for endometrial growth, and then you can see the arrow pointing to normal endometrial lining. But there are many areas that are common for endometriosis to occur. All right, diseases of the prostate: inflammation from infections, STDs, or benign hypertrophy, prostatitis, which is a general term for inflammation, or carcinoma of the prostate. We're not going to look at all of these at this point, but here is a normal prostate that you can see just inferior to the urinary bladder, and an enlarged prostate. So you can see clearly from this diagram that even benign hypertrophy of the prostate can interfere with the flow of urine, among other things. All right, so here's benign prostatic hyperplasia, which is an enlargement of the prostate gland and a partial blocking of the urinary bladder that results. So if the bladder cannot be emptied, the residual urine provides a medium for infection, and cystitis can develop. And a weak urination stream would also develop. The blockage of urine outflow places back pressure on the ureters, which cause them to become congested with urine, a condition called hydroureters. And this can extend to the kidneys, and hydronephrosis can result, which is a lowering of urine flow. An imbalance of sex hormones frequently can cause this enlargement. The level of testosterone generally decreases with age, but estrogen from the adrenal cortex continues to be secreted, and it changes the ratio of those two hormones, and this is often the cause of that hyperplasia. All right, here again is the normal prostate and its relationship to the ureter, or excuse me, I should say the urethra in the male, not the ureter, the urethra. And with benign prostatic hypertrophy, a trickle of urine would be produced rather than a good normal urine flow. Cryptorchidism is not a disease, but a failure of the testes to descend from the abdominal cavity. And this condition can be corrected through surgery or hormonal therapy. If this condition is not rectified, sterility will result because, as you may recall, the sperm do not develop at what we consider normal body temperature. The scrotal sacs provide the sperm to develop at lower than body temperature, lower than the temperature of the abdominal pelvic cavity. The undescended testes could atrophy and could be a potential site for cancer. So this can be a serious condition. Here is a diagram of the undescended testicles. Cryptorchidism literally means hidden testicles. If you recall your medical terminology, and if you don't, take out your Taber's. Hopefully you still have your Taber's medical dictionary. And this shows you the normal path in green for descent of testicles, and then an aberrant path which could prevent the testicle from properly descending. STDs. The incidence has increased in recent years, and serious conditions could result that could gravely affect a person's life or even lead to death. An estimated 1 million women contract pelvic infections each year as a result of undetected STDs. And one of the major issues is that infected individuals often do not have symptoms for many, many years and can spread the disease unknowingly to other sexual partners. And the STDs could spread to the offspring during pregnancy or childbirth. Sterility, ectopic pregnancies are common complications of STDs. Genital herpes is one common sexually transmitted disease or infection. It's painful. It's caused by a virus, a herpes virus. The type 1 herpes virus causes the common what we call fever blisters or cold sores. Type 2 involves the mucous membranes of the genital tract. And as you can see, symptoms appear within 3 weeks after exposure to the virus. Multiple blisters appear, and again, this is highly contagious. This is what some of the lesions may look like, and a large, in your upper left, a large electron microscopy of the HPV virus. All right, active phase subsides as the lesions heals, but the virus remains dormant until it is reactivated. So the disease is transmitted by contact with an active sore, but the virus can be spread from a cold sore on the lips to the genitals, and the reverse is also true. There is no cure. So really, precautionary measures are much advised, and for a person to know who they are having sex with in terms of what STDs they may carry. That's just the only way really to stop the spread of these conditions. All right, prescription medications can control the activation of dormant infections, and notice that AZT, which is a drug also used to treat HIV, is often used. The active virus has serious consequences during pregnancy, can cause spontaneous abortions, premature delivery, and also increase the risk of spreading this condition to the newborn child. All right, so that is the conclusion of the material I wish to cover with you, the examples that I am emphasizing. I do have a list of videos available to you on your Moodle page for you to look at. So here's the list of them. This same non-narrated PowerPoint is available to you on the Moodle page. Any questions, please contact me, and I will be in touch again. That's all for now.